Okay, so a pheochromocytoma is a tumor of the adrenal gland, which secretes epinephrine and norepinephrine. And the tumor is actually pretty rare. It's not very known or not very common, and it also is most of the time non-cancerous, so benign. There's just a few cases where it could be malignant. Some signs and symptoms, so like high blood pressure, tremors, paleness of the face, shortness of breath, headaches, heavy sweating, a rapid heartbeat. It's more of like panic attack type symptoms that you might see. Researchers actually don't quite have a cause for the tumor. The tumor does develop in specialized cells called chromaffin cells that are located in the center of the adrenal gland, but they still don't quite know exactly what causes it. They have determined, though, that the tumor can be inherited. It can be passed down. Diagnostic testing. So the doctors will kind of start out with doing like lab tests, so like a blood test or even a 24-hour urine test. So you collect your urine for 24 hours every time you urinate. These tests will measure like the levels of epinephrine and norepinephrine and see how your body is fluctuating these. Once they get an idea that it is a pheochromocytoma, the doctors might use image testing, so like a CT scan, ultrasound, and MRI to locate the tumor so they can come up with that diagnosis and a treatment plan. So a treatment plan. The doctors or your physician will more than likely want to have the tumor removed by surgery. So before the surgery, your doctor or physician might give you some blood pressure medicine that will block the high adrenaline hormones to lower your risk of high blood pressure during the surgery. You'll have to more than likely take these medications for about 7 to 10 days before the surgery. And if the doctors see that the tumor has spread to other parts of the body during the surgery, before, after, whatever, radiation and chemotherapy might come into play to help minimize that. Treatment at home, there's not much of a treatment you can do at home. But while you do have the tumor at home, you would more than likely want to avoid foods that are most likely like fermented, aged, cured, or spoiled, or anything like that, because those foods are high in tyramine. It's like foods such as like cheeses, beer and wine is one of them, chocolate, and dried and smoked meat. A prognosis for the tumor. It's hard to determine a prognosis because every tumor is different and every patient is different. However, most of the time, patients with a smaller tumor that has not spread to other parts of the body are usually given about a 5-year survival rate of about 95%. So it's not horribly low, but still, I mean, there's always that 5%. And then patients with a pheochromocytoma that has gone back or spread around the body have about a 5-year survival rate of about 30 to 60. So it's significantly lower, but yeah.